So before we get started, I'll introduce myself and I'll just give everyone a little bit of background about what we'll be talking about today, and then I'll let our guests introduce themselves. So if I don't know you, my name is Amy Prophet. I'm the Director of Marketing and Media here at CHIME, and I'm really excited to be part of this webinar today. Before we get started and introduce our guests, I'm going to just provide a little background. As you know, COVID-19 has put an unprecedented challenge and focus on digital health. Wellness apps and technology do enable patients to access and manage their health, and they empower physicians to deliver care anytime, anywhere. Over the last several months, digital health innovations have been rapidly implemented and scaled to provide solutions in response to a variety of healthcare delivery challenges. However, shifting health systems economics and revenue growth due to COVID-19 has posed some challenges as health systems try to navigate this complex post-19 COVID world. And so who we have with us today are some very bright gentlemen who have a lot of insight and knowledge to share with us today on the whole post-COVID-19 world. And I'm going to let them introduce themselves. So Dr. Zane, if you'll go ahead and introduce yourself and just share a little bit about your background today.
Sure, thank you for having me. My name is Rich Zane. I'm the Chief Innovation Officer at the UC Health, University of Colorado Health System. I'm also the chair of the Academic Department of Emergency Medicine at the University of Colorado School of Medicine and a professor at the medical school and at the business school.
Wonderful. Thank you for joining us today. It's great to have you. And Vishnu, why don't you go ahead and introduce yourself?
Sure. Thank you so much. And Dr. Zane, good morning and good morning, everyone. My name is Vishnu Saxena. I'm a Digital General Manager of Healthcare with the DHC Technology. And I'm also a CHIME Media Liaison. Very honored to be part of CHIME community. And I'm very honored to join this CHIME Media live broadcast with a great healthcare leader who is at the forefront of transforming healthcare through digital health and innovation, Dr. Richard Zane. So looking forward to have a great discussion. Amy, Dr. Zane.
Great, thank you both. So Dr. Zane, no pressure, but I'm going to start with you today. What does digital health innovation mean for health systems post-COVID-19, and what do you think is the impact of COVID-19 on healthcare innovation?
So great question. I'd love to take just one notch back, if I could, and just say a little thing broadly about digital health and innovation and what that vernacular means. Because when you think about digital health, or you think about innovation, or you think about virtual health, or you think about data science, it can mean everything and it can mean nothing. So for us, I really lament the term digital health and virtual health, because what it really is technology-enabled actual healthcare. There's nothing virtual about it. It may be digital because it's over a digital medium, but we don't call, when you go to the doctor, you don't say, I'm going for bricks and mortar health. I'm going for in-person health.
Right.
Or on a train health. You're going for healthcare. So that leads into the second part of your question, which is what has COVID-19 done to healthcare? And essentially, when we think about technology-enabled actual care, it simply accelerated everything by creating this barrier, for lack of a better word, between the physical presence of a patient to the physical presence of a provider. It was a force function into this digital or virtual pathway. And what we learned was that it is actual care. And what we learned is that it's good care, and a lot, not everything, can be delivered on this platform. And what patients learned, which I think is really important, is that it actually is good care. You can have a personal, intimate conversation relationship with healthcare. You get it in a much, much more convenient way without having to get in a car, drive, get in traffic, park, and in this case, put on a mask and potentially expose yourself to something.
Right.
So I want to shift the entire vernacular of this world of innovation and talk about technology-enabled actual care.
Right.
I love it. I love that whole position that you bring to the table. Vishnu, in your work with a variety of health systems, how has digital health innovation helped health systems manage the crisis and navigate to the new normal?
Yeah, no, I mean, and I completely agree with what Dr. Zane just said. When we go to a hospital, we get, we intend to get the healthcare. We are not going to brick and mortar or the virtual. So I think that's a great point, and I love that phrase. So, and to your question, Amy, how digital health innovation has helped, and helping over the last couple of months in managing this crisis. So, as we all know, I mean, digital health innovation is not new, right, in the healthcare world, but rather the speed of adoption was low. So on the consumer side and on the physician at the enterprise level, at the hospital level. But over the last 4 to 5 months, almost every system have implemented and scaled those innovative digital health solutions. And I believe more than that they have done, they have accomplished more than what they have done in the last 4 or 5 years. So the debate about using digital to transform healthcare is over. So I think that is the significant thing which has happened, that health system leaders are no longer debating about the value of the digital and how they can leverage. So that is at the forefront. And in my experience in in last couple of months, digital health innovation has significantly helped health system across 4 major areas. One is recapture in patient demand, because the patient demand certainly dropped because of all the elective processes and all put on the hold. And health systems are using lots of digital outreach and engagement tools to reach large subset of the patient with customized messaging to reestablish consumer confidence and consumer connectivity, while educating patient that that the things are fine and reassuring, and making sure that they are aware about that the healthcare services are available, relevant to their needs, and they have taken care of COVID versus non-COVID situation. So health systems are deploying lots of digital patient engagement and progression tools, I call it, and proactively promoting self-service. Lots of self-service being deployed, and they are optimizing digital front door. No one better than Dr. Zane knows about it. And mobile apps, patient portal to support clinical and other messaging. Virtual visits, of course, has been at the forefront. I'll talk about it in a minute. And then, of course, the all care modalities, automation of clinical questionnaire forms and all. So when we go and, no longer essentially sit and, do the filling of those forms. So those things are being automated. And I think that's very helpful. Bill pay and reminders and all. The other thing, the second point, which I believe is significantly important, is, and that has brought the largest change using digital, is digital care delivery and model. So it has shifted to outside of the hospital walls, and it is now the model is which is very preventive, safe, personalized, and participatory. And yes, you got it right. I'm talking about the virtual health. So virtual health, for example, and I take the comment in a positive note from Dr. Zane. But in the sake of the conversation, so the virtual health, for example, has evolved. It used to be like nice to have the visits were in like double digit in a given day or a given week or a given month, but it has skyrocketed in hundreds. So it has from nice to have to need to have, and it has become the backbone of care delivery. And I would say it has a like safe front door. So the number of telehealth visits over the last 20 weeks is like decades of adoption. So I think that has a significant, change, and something that has helped health system out. The number 3 that I think it's significantly important to highlight is, the restructuring of the physician enterprise. So health systems are essentially restructuring physician enterprise, and they are pivoting from a physician-centric care delivery to physician-led integrated care teams, and expanding the definition of the care, the clinical workforce, and deploying care teams member in a fundamentally different manner. So I think that's restructuring the physician enterprise is something is very critical. And for example, they are deploying patient progression and the management tools, right? For example, integrating multiple system of record like EHR, CRM, ERP, you name it. And then they're supporting clinical communication and adopting strategies, to enable and reinforce the new distributed multidisciplinary care model. So I think that's the significant. The another ways where innovations are improving and helping is through reporting and analytics structure. Essentially, to support the new provider enterprise to monitor care team utilization. I think this is significant, and the cost. So I think that's another way where digital is playing a key role. And the fourth is, I think, the clinical operating model. I think that's the significant, because the clinical model transformation where is something is on the radar of on the business leaders as well as the CIO leaders, and they are leveraging digital innovation, and they're accelerating the real-time analytics, prescriptive analytics capabilities to improve capacity management. Because as the surge happens, so I think it was it was very unpredictable, right? So how to improve the capacity management, because it is here to stay. Things will change.
Yes.
And service rationalization. So I think we have some of the areas which I feel, digital has contributed a lot in managing the crisis. And I think it has set a foundation, where the future, and they will continue to scale and expand.
Absolutely, and I completely agree with you. I have a follow-up question to that. COVID has posed significant cash and margin challenges for almost every healthcare system. How do you see innovation and technology being leveraged to reduce healthcare system cost base?
Yeah, no, I think that's the burning question of the executive leadership at the health system and all the forums, because now post to the COVID, the overall the market size is reshaped and resized. So I think the cost is playing a very important role. And for most of the health system, cash and margin needs are very significant, and there's an immediate need given the projected market size. So it is, and it has to do with also the degradation of the payer mix, because it is unlikely that the volume can recapture the volume, and the growth strategies alone will restore the required level of the liquidity that is needed and the financial margin that is needed. So digital innovation is something that everybody is looking into it, and the technologies that can, and it has a tremendous potential in terms of bringing immediate and the long-term opportunities to reduce and the restructure the health system cost base. So for example, I have seen personally in my discussions with many CIOs and the health system leaders that they're using, and they're taking very serious look at the administrative cost basis, and they're applying digital tools, self-service, AI-enabled automation tools such as robotic process automation (RPA) that can perform routine, repeatable tasks in a very cost-efficient manner, and therefore it can eliminate the time-consuming and manual functions, services. For example, registration, billing, supply chain, HR, right? Scheduling, appointment, and the follow-up reminders. So I think the self-service, automation, AI, I think these are the the areas that is not new, by the way. It has been looked into. It was in the consideration before, but I think now they are being looked at very seriously. And another areas where I see digital is driving cost saving is through accelerating real-time predictive and prescriptive analytics, as I mentioned, because that has a significant potential to improve capacity management and service rationalization across the location, care cost, quality, you name it. So and importantly, safety for COVID-19 and non-COVID-19 patients, and for the potential surge. So I think the automation and analytics and I would say the prescriptive analytics is some of the areas that can drive the tremendous cost saving.
Thank you for that. Dr. Zane, I'm going to switch it back to you. Taking all the lessons that we've learned from COVID-19, and I think we'll continue to learn through the remainder of the year and so on, as we look to the future of healthcare, what will the digital healthcare ecosystem post-COVID-19 look like? How do you envision that?
Well, let's think about what it is that we had hoped for before. So I think if you were to have gone May April, whenever we think COVID started, and you looked at large health systems and you asked them to think about what it is they were hoping to be able to do on their virtual or digital platform, you will find that almost everybody and their sister had doctor on demand. Most people had some type of virtual ICU. And then some of the more advanced systems had lots of subspecialty remote consultations or second opinion services. I really think that that is the basic blocking and tackling. I'm very fond of my parents who are in their 80s. They have an iPad. I can FaceTime with them. It's not rocket science, right? That is not virtual health. What digital or virtual health is bringing this electronic platform in a unifying way to link patients to healthcare and inject all of the tools that almost every other industry has done. I'll give you an example. When you go on to Amazon and buy a pineapple, it just doesn't show you a picture of a pineapple in the supermarket next to your home. What it does is it brings all of your information, your preferences, different pineapples, and how it's going to get you that pineapple. What's the best pineapple for you? So that we can call it a lot of things. Some people call it AI. Some people call it prescriptive intelligence. Some people call it clinical decision support. So our vision is that all patients in some way interact with us in a digital or virtual format. And it could really be as easy as your primary care doctor is on the other side of the screen. But that primary care doctor also has in the platform with the electronic medical record, not only all of your laboratory studies and your history, but all kinds of other data that are integrated in a very systematic way that says, Dr. Jones, Ms. Smith is at risk for breast cancer. She's 53 years old. Her mother, sister, brother has this type of genetic mutation. You should bring this up now. So that in the 11 minutes that a primary care doctor has to interact with a patient, they get hours upon hours of assimilated information where they can use human adjudication to help that patient understand. Things like memorizing medications, looking at hundreds of pages of charts are not rational uses of humans' time. Right. So the way that we think about virtual care and is being accelerated is integrating all of these other things that are referred to as intelligence or AI or big data into the platform so that we can take the machine doing the first, insert percentage here. I always get some hateful email that I've said too much or too little. I think that 85% of what a doctor does can be done by other, whether that's bot, some extender, something like that. And then let's allow the virtual platform to surround the patient, ensconce them in care, and whether you want to call it monitoring or surveillance, and then bring forward what is required for human-to-human interaction. And that's going to be different. We have a project where we look at deterioration in inpatients. So patients who are not in an ICU, who have sudden changes. In an inpatient setting in a hospital, it's impossible to go minute, right? A nurse will come every 5 hours, you ring the bell, you've seen it. But what really happens in between those moments in time. So let's go to the other end of the spectrum. You're at home in your normal life and you are at risk for an exacerbation of a chronic disease. We should have the ability to assimilate and integrate information about you, not in a creepy way. Right. When you are having an exacerbation of a chronic disease, but you're not yet symptomatic, which happens very frequently, we can intervene. And that intervention could be your watch saying, Mrs. Smith, did you remember to take your diabetes today? Because your glucose is awfully high. Or it could be, hey, Tom, you know that you are supposed to get up and walk around the room at least twice a day. You haven't done that yet. Something like that. And then really everything in between. We should never have a medicine untoward interaction. Again, it just seems ridiculous that if you go to Walmart and you buy Tylenol and then you go and get a prescription for acetaminophen somewhere else, that somewhere we should say, hey, you're taking the same thing and it's too much of it because it's just too easy. Planes do it all the time. So that's where We want it to go. What I think COVID has done has really been a forced function. And I do not want to take away the importance of how deregulation around virtual health has allowed us to cement this into a never go back thing, right? It makes zero sense that a doctor can't practice across a straight line, across a state line. It makes zero sense that there shouldn't be some type of payment parity for virtual care because it's actual care. Those were hard structural barriers to virtual care actually growing and blossoming. And recently we saw that hopefully the payment reforms will be permanent. But what I hope to see is that you could very well have your primary care physician in Iowa if you live in Chicago. So that just like many of us who've moved around the country, if you think, very often you keep the same family lawyer and the same financial planner.
Right.
Why would the same primary care physician who knows all about you? It's structural barriers that have not grown with technology.
Absolutely. And just to insert my own thought into that part of it, when we think about the patient experience and really patient-centered care, it's so important to have that continuum of care and to have consistency in who's delivering their care, and how stressful it is if someone moves that they have to sort of start all over again. It really does not need to be that way with the technology that we have in place, and how much better people could be taken care of and not be stressed out about their care just for a simple move or going on vacation for a few months to stay with another family member across the country. It should all be doable and have their care follow them.
And now, it's very common for behavioral health. People have very long-standing relationships with psychologists or psychiatrists,
Right.
and just you can't cut and paste that type of a relationship. And if we allow virtual health to continue the way that I think it should continue, that human part is going to be so very important, because that human is no longer going to be measuring blood pressure and saying, chart A recommends drug number 2. They're going to be having human conversations saying, here's this medication, these are the side effects. I know that your sister lives with you and, is allergic to this and the other, so maybe we should do something else. And it's that type of adjudication that will differentiate the new healthcare. Virtual care can support that.
Absolutely. So to tack on to that conversation, what do you think it looks like, or how would you describe health systems going from doing digital to being digital?
Doing digital to being digital?
Yep.
It's really a cultural transformation. It means that we have some guiding principles around what it means to interact with digital health. And again, digital health, clinical decision support. For us, it's really connection, communication, and bringing intelligence into the provider workflow. So we have a single instance of a mature, robust electronic medical record, right? 12 hospitals, lots of providers across an entire state. Everybody is on the platform. So everything has to be within that platform. Everything we embed, integrate, has to be within that workflow and within that platform. So that's a way to make it permanent. The other is we never ask a patient or a provider to leave that workflow. So if I'm taking care of you, and I'm taking care of you because you have cellulitis on your chin, and then all of a sudden you tell me that, oh, you know what, my stomach hurts a little bit, I can't leave this platform, go to another platform and say, this is the stomach platform and this is the chin rash platform. So everything is unified. The other is that this concept of clinical decision support and AI has to make it easier for providers and not harder. So one platform, one workflow, easier, not harder. Path of least resistance. It must be the path of least resistance. And on a very basic level, it has to be fewer clicks instead of more clicks. And then on a not so basic level, it just has to be bulletproof right every single time.
I love it. I think we should apply that to everything that we do, and not just healthcare, and make things a lot easier. Vishnu, I want to switch to you. There's no doubt that the adoption of digital health by patients and physicians has increased dramatically, especially during COVID. What do you think about the consumer behavior and adoption of digital health post-COVID? Will that sustain?
Yeah, no, I think, and the answer to that is what Dr. Zane just touched upon, going from, doing digital to being digital. And I think this is extremely relevant as we talk about consumer experience overall. The behavior change, is all linked to the need and the experience that we have. So COVID-19 has changed the way consumers wants to engage with the health systems and and with the providers and what they expect from the providers. So I think that's a significant way, and that's the way things have changed. And people are living differently, they are buying differently, right? And in many ways thinking differently. So and there's a significant shift in terms of the consumer behavior towards adoption of digital. And I recall just like a couple of months ago, and I think it has a speed up in terms of the number of mobile health apps being added every day, right? So we used to call like 303, 400 apps being added every day. And the adoption was so poor because many of these digital assets they were built not keeping patient convenience and their objective in mind. So it was like, let's do some digital health innovation, let's create some mobile app and throw it on the patient population. And the patient didn't like it and they have not used it. And it is the case across the board if you talk about the health plans. So many of the health plans have member engagement app and the portals, right? And if you talk about their adoption, their usage, they're struggling there. So I think at the same time there has been a learning curve. There has been a kind of maturity now, and the patient is at the center in terms of what their needs are, and not only applying it across the board, but in terms of doing a little bit micro segmentation in terms of a segment of the population's need might be different than another segment of the population's need. So I think when it comes to, I think that has been understood. Having said that, I think the critical thing depends upon how the confidence the health system and the providers can provide to the patient. And I recall in our previous conversation about a survey that PwC's Health Research Institute they have done, where the 32% of the consumers they said that they have already made or they're planning an adjustment to their spending on the healthcare visits, right, post-COVID. And 78% of the consumers out of the survey said that they skip at least one visit, whether it is a wellness visit, maintenance visit, or the chronic illness and whatnot. So I think we have to, so I think that's where when it comes to doing digital to being digital and providing a safe access to care, a safe front door, and providing the assets that essentially provides a better experience, because if you provide a better experience, that drives better engagement. So, and I think, in my opinion, of course, it's going to skyrocket. The adoption will skyrocket now, and I think that's the way to go, I guess. Yeah, there's no doubt about it, because now the learning that we had through COVID, the learning that we had through the failed apps and all these assets and the poor adoption, I think things have changed.
Thank you. So before we end our insightful conversation, I'm going to pick your brains a little bit. And Dr. Zane, I'll start with you. What 2 pieces of advice would you give our audience on leveraging innovation to drive transformation post-COVID-19?
I think the single most important thing I tell people, whether they're people who are working with me, for me, whether they are people who are trying to sell me things or develop things with me, is what problem are you trying to solve? The last thing I need or anyone needs is someone envisioning a problem that does not exist and building a solution to a problem that does not exist. So first, go to the front line, understand healthcare, figure out where the pain points are, and drive solutions towards those pain points with the patient's lens in your focus. Otherwise, we're just sort of spinning around in circles.
Absolutely. Vishnu, what about you?
I completely echo with what Dr. Zane just said. And I think it has to do with really understanding, contextually relevant the problem. So each health system, so there are certain problems that that most of the health system have, but given that a health system geography and location, so they have a unique set of challenges. They may have a specific problem that other system may not have. So I think the assessment of that is strategic, unique problem, and then understanding how the digital can solve, creating a business case. And I think, as I said, and as I learned that, I think that there's no debate on digital anymore. So as long as the problem is identified and assessed, and a business case is made, and I think then you can define your digital destination with the target milestone and then start the transformative journey. So I think it is to do with identifying the right problem and defining the pathways to achieve that, to solve that.
Great.
Absolutely. And I think all that to say, and I feel like every conversation we have around health in general, if we keep the patient in the center of our focus, you really can't go wrong. It really needs to be consumer or patient focused, and then the rest of those logistics can be worked out. So anything else you want to offer our audience before we end our time together today?
Don't go back. There's never going back.
I like it. Well, thank you both so much for joining us today. Thank you to our guests who are joining us today as well. And I wish you all the best as we move forward in this crazy time, and just to stay safe and healthy. Thank you all for this great conversation.
Take care. Bye-bye.
Thank you, Amy. And Dr. Zane, thank you so much for coming on board. Thank you. Take care, Amy. Have a great day. Bye-bye.
You too. Bye-bye.